Every other Thursday, we take a look at a health issue or concern affecting many people. We break down the information for you and tell you what you need to know to keep you healthy. In this morning's Ask a Doctor, Dr. Kalani Brady from the John A. Burns School of Medicine joins us with, well, what everyone is talking about. It's a big topic, the COVID-19 vaccine. Is it safe? Should you get it? Dr. Brady joins us now with all the details. Good morning, Doc.
Good morning, Kelly.
Okay, so let's start off, I guess, with the basics. What exactly is the COVID-19 vaccine? What will this vaccination do?
Well, first of all, let's talk about why. We've been battling COVID-19 with masks and hand washing, social distancing, and these kind of things, and it's been hard, and it has taken its toll on society. We can see the most flagrant rise in COVID-19 cases around Christmas and New Year's when we had all those parties. But now we have an answer to help us with continuing to use masks and hand washing and social distancing, and that is the COVID-19 vaccine. There are 2 vaccines out. There are 2 vaccines coming out that aren't out yet, but we're going to have a large number of vaccines. The effectiveness is about 95%, Kelly, which is a great, it's a powerful vaccine. It's the present 2 that are out are dose vaccines, and they're usually 2 to 3 weeks apart, and they protect us. They're not instead of the masks and hand washing and social distancing, but they're a powerful armamentarium against COVID-19.
Right. And I think a big concern with the vaccination that people just have in general is, it was a vaccination that was created very quickly. And, there are 2 that are out now, but there's going to be 2 more. I think people are just some people are saying, I'll just wait to see how it plays out, or maybe to see if there's a better one that's going to come along, or to see if people do have any long-term side effects. What would you suggest to people who have those concerns?
I think the vaccines have been tested. I think I've had my vaccine. I certainly think that compared to COVID-19, with more than 375,000 Americans dead because of COVID-19, is not worth playing with. The vaccine is very, very effective, and I wouldn't wait for side effects. I would get the vaccine as soon as possible. So the state of Hawaii Department of Health has a phase system where people like me who see patients on a regular basis get the vaccine, and that started in December. Phase 1B also covers people over 75 and teachers, educational support staff, and phase 1C, which starts in March, covers people age 65 to 74 and those with chronic disease. We have at this point about 500,000 doses of vaccine coming into Hawaii over the next 6 months. So there's no reason not to get your COVID-19 vaccine, and you should use the COVID hotline, either the website, which is hawaiicovid19.com, or the Department of Health number, which is 586-8332. Those 2 sources, starting tomorrow, you can sign up for a COVID vaccine.
Okay, good to know. And again, this is a system that's gradually going to be rolled out. So more and more folks going to be able to get their vaccination in the coming weeks and in the coming months. So throughout this time, do make sure you're still wearing your mask, social distancing, washing your hands, because we are nowhere near in the clear from this at all.
Right.
Okay, perfect. Thanks so much, Dr. Brady, for joining us. I know a lot of people, of course, the vaccination is top of mind for everyone, and I think that answered a lot of people's questions. So thanks so much.
My pleasure.
All right, and happy Thursday. I love that you're still rocking the winter attire for the tie. Love it.
Of course.
So cute. Thanks so much, Dr. Brady. We'll see you next week.
Yep.
Him and I are on the same wavelength. I still haven't even taken down my Christmas decorations, and I'm not about to.